Hello, my name is Brittany and I'm the registered dietitian at Celine Heart Group. I'm going to be talking to you about congestive heart failure. Congestive heart failure occurs when the heart is not pumping efficiently and it's unable to pump oxygen into the body. Heart and kidney diseases such as hypertension and chronic kidney disease can lead to congestive heart failure. If you consume too much sodium or drink too much fluid, your body's water content may increase and make your heart work harder. But if you control your sodium and you can control your fluids, you don't have to make your heart work harder. So we're going to talk about a few things to make that easier on your heart. So in our body, water follows salt. So if we have a large intake of sodium, a lot of water will follow and it makes our heart harder to pump. It actually increases blood pressure and therefore can put you into heart failure. We want to decrease those symptoms and decrease that hospitalization. So I'm here today to talk to you a few of those things. So how do you reduce salt in your diet? First of all, you can consume fresh fruits and vegetables or frozen fruits and vegetables. These contain very low sodium content. Even consuming canned vegetables or canned fruit, making sure that you're getting fruit in its own juices, and then looking for canned vegetables that contain no salt or very low sodium, and making sure you rinse them with water before consuming them. So what is sodium? Sodium is a mineral found in all kinds of foods, fresh fruits, fresh vegetables, and processed foods. Sodium is going to be something that we do need to monitor for our heart patients. It does contribute to having a balance of fluids in our bodies. But with our heart patients, and especially the heart failure patients, we need to make sure that they're consuming a low sodium diet so that it is minimizing the fluid buildup that can be put around the heart, the lungs, and the swelling that comes through the legs. As far as looking at our nutrition facts label for processed foods, packaged foods, convenience foods, we want to be careful. An intake of less than 2,000 milligrams per day is recommended for our heart failure patients. So whenever we look at the nutrition facts label, it's a list of nutrients that can be found on many packaged items. We want to look for 350 milligrams per serving or less to make sure that we are not overdoing sodium consumption throughout our day. In cooking, some ways that we can reduce using sodium is eliminating the salt shaker. Eliminating the salt shaker can reduce 20% of our sodium. Even one salt shake can be up to 250 milligrams per shake. So if we're doing a few of those, that sodium content can really increase. We want to be creative in the kitchen. We want to include fresh herbs like rosemary, oregano, basil. We want to use other spices like garlic, chop up onions, and throw that into our seasonings or into our food to incorporate different flavor profiles. So we are decreasing that sodium but increasing that flavor. We also want to be careful of condiments such as ketchup, mustard, barbecue sauce, because those can increase that sodium intake throughout our day. Whenever we're eating out, the chefs like to load up the food with sodium, with dressings, condiments, sauces, those kinds of things. So we do have to be very careful and be very conscious whenever we're eating out. Removing that salt shaker from the table again can remove 20% of the problem. Asking for condiments on the side, such as that salad dressing or a sauce, can also help control that portion size or that sodium that you're adding. Asking the chef even to decrease the amount of sodium or MSG that they're adding to the food, and then always trying to shoot for adding more fresh fruits and vegetables because you already know that those are low in sodium.